Ladies and gentlemen and colleagues of the Senate, on your desk I asked the pages to distribute a legal-size memo. If you would look at it, this is in response to a newsletter that our colleagues in the House distributed last week, the Republican caucus, and I thought it interesting and important for us, since we both now have bills in our chambers discussing the increasing use of Medicaid. I wanted to use this opportunity to provide some real information and start the dialogue that we are encouraging. In this memo that they sent out last week, it talked about the 7 reasons why we should rethink Medicaid expansion. Now, I think that's a good question. And so because of that, I took time this weekend and responded to each of their discussion points. I could tell you that there is lacking in clarity and also accuracy. So what I want to do this morning is just talk with you about this. I'm going to refrain from providing any kind of response that would be detected as conflict between us, because I think this is the kind of information we need to really have a dialogue about. So I think the first part of this is that their sentence in their first paragraph that said the media has peppered Americans with all the reasons why Medicaid expansion is the way to go. The purpose of this article is to show the other side of the coin, why expanding Medicaid could be dangerous. I think that's a good statement. I think if people think it's dangerous or questionable, let's get it out in the open. Let's talk about it. Their first point was that over the next 10 years, if all 50 states chose not to expand Medicaid, the federal government would save $654 billion in a country that has a record deficit. Entering into an agreement that is primarily funded with federal dollars is not wise. If that was true, then we probably should not consider expanding Medicaid. I agree. But it's not accurate. In the Affordable Care Act, the savings to fund Medicaid expansion comes from the elimination of the federal government's payments to hospitals for the disproportionate shared hospital payments and from a reduction in Medicare fee-for-service rates in addition to Medicare. These payments go to hospitals that care for a high proportion of the low-income Americans. The estimated savings, not expenditures, is $741 billion, and the estimated cost for the federal share is $643 billion. There's no additional stress on the federal government's budget. Actually, there's a savings. The source of that statement is from the CBO's letter of July 24th to Speaker Boehner. He goes on and says, if Iowa did not expand Medicaid, the federal government would save $4.1 billion over the next 10 years. Again, if that was true, we should probably consider not doing it. But the Affordable Care Act payment structure is indeed complicated. But by the state not investing in Medicaid, the cost to consumers will continue to increase by the billion-dollar annual uncompensated care hospitals and providers charge back to private insurance policyholders. This is far more than an investment. This is far more than not investing in insuring more Iowans. Now, the second point, costs to the state. The statement last week said that actuarial reports estimated that it will cost the state between $171 million and $536 million for the 7 years of implementation. Well, let's look at the facts. The House newsletter deletes critical data in claiming that there is a huge cost to the state. Jess Benson of the Legislative Service Agency wrote that according to the Milliman Report, and the Milliman Report was a report conducted by the Department of Human Services. They are an actuarial firm, and they issued 3 reports. The most recent report is the one he's talking about. That there is a cost to what they call the woodwork effect, which we will see if we expand Medicaid or not. So the woodwork effect is generally those people who are still eligible for the existing Medicaid program versus the cost of expanding Medicaid. And their numbers are right. $327 million to $564 million between those same 7 years. Regardless, but this is the difference, that's regardless of the expansion of Medicaid. So their contention that the actuarial reports are implied if we expand Medicaid is just not true. That's the cost of Medicaid over the next 4 years, even if we don't expand Medicaid. Jennifer Vermeer, the Iowa Medicaid director, agrees. In a memo summarizing the Milliman report to Health and Human Service Director Charles Palmer, she states the Medicaid cost to the state ranges from $171.2 million to $536.6 million, but this increase is entirely a cost associated with the existing Medicaid program. The cost of enrolling the newly eligibles through expanded Medicaid, associated with expanded Medicaid, actually creates a savings between $118 million and $206 million. I want to go over just a few more points. These are important because if we don't speak up against them or we don't try to clarify them, if we don't dialogue with our colleagues, people will think that that newsletter is accurate. It's anything but accurate, but we're trying to correct it. The third point is that the Federal Medicaid Assistance Program, FMAP, is used to determine the amount of federal matching funds for state expenditures for state Medicaid expenditures. In 2004, the FMAP percentage was 63.82%. For 2014, it is estimated to drop to 58.3%, which is 5.5% lower than 2004. This means that over the next 10 years, the state has picked up $192 million in additional Medicaid expenditures that the federal government previously paid for. This goes to the argument that you can't depend on the federal government, that they're actually not fulfilling their obligation to us. But they didn't tell you the whole story. Jess Benson of the Legislative Service Agency provided the following response in an email to me February 2nd, 2013. In response to your question regarding FMAP rates and how the regular FMAP formula works compared to the Medicaid expansion formula. The regular Medicaid FMAP rate is based on a 3-year rolling average of Iowa's per capita income compared to every other state. Because Iowa weathered the recession better than most other states and continues to do better economically than almost every other state, our FMAP rate continues to decline. Although the federal government could change any FMAP rate formula at any time, the reduction in Iowa's FMAP rate is based on the formula that has been set for decades and not changes in federal law. Now that's probably gone all over your head. It did for me for a while. But it means that the formula that funds the existing Medicaid program is based on a formula. Every state has it. We've had it since 1965. And if your state is doing better, that means more people are less likely to need Medicaid. So that percentage goes up and down. It has done that since 1965. To say that it has cost the state $192 million is factually wrong and misleads the public. He then goes on to say in the memo, as you see, that the FMAP for the expansion of Medicaid is fully funded by the feds for 3 years and goes down to 90% after 5 years. To put this in context, the existing Medicaid program is as you see, a 58 to 38 difference. That is true. 60-40 is what we usually use, but that FMAP goes up and down. But on the expanded Medicaid, it's a 90-10, and it stays at 10%. That does not change into the future. Now, you could look at Section 3 and 4 on your own. I want to point out Section 5. And anybody that would tell us that we should keep our comments short, I apologize. I hope to do this only once to you. But when we write things, we need to make sure they're correct, because this next section is very important. It talks about, as the Republicans in the House newsletter said, there is no take-backs. Studies show that states almost never rescind Medicaid coverage once it is implemented. If Iowa expands Medicaid, the estimates are that 150,000 additional people would be covered. In a state that has seen the old Medicaid program grow 50% in the last 12 years, a decision to cover an additional 150,000 lives should not be taken lightly. The Centers for Medicaid and Medicare Services in Washington issued a letter to states that there is no expiration date on their decision to expand Medicaid. This means that states can take their time in making the right decision. Wrong. What about Iowa Care? This is the Iowa version of the expanded Medicaid program that a divided legislature created in 2005. Statutorily, it is scheduled to expire this October 31st. It is true we should not take lightly the decision to cover an additional 150,000 Iowans, but we cannot abandon the 70,000 Iowa Care patients, because without expanded Medicaid, 70,000 Iowans would be thrown off health insurance. In Iowa, the legislature has a prerogative and the responsibility to change our Medicaid program. The governor cannot do it without statutory authority. He can recommend, but he cannot create any new program without legislative authority. That is why Senate File 71 and House File 83 were filed last week. This point lays out the question before the legislature in stark terms. There's an opportunity to provide health insurance coverage to 150,000 Iowans who are either unemployed or whose employers cannot or will not provide for them. We can allow them to continue to be uninsured, or we can take advantage of a cost-effective federal match that will allow them to have health insurance coverage. The decision should not be taken lightly at all, but because it is a tremendous step toward our shared goal of becoming the healthiest state in the nation. And then my last verbal response to the House Republican Journal is something of a dangerous statement. It says that a 2012 study in Health Affairs concluded that 1/3 of doctors won't take Medicaid patients because of low reimbursement rates. It goes on to say, does Medicaid expansion really save lives? Another good question. 3 states did studies regarding their expanded Medicaid population. All 3 states had different conclusions. My response is that the ACA addresses provider shortages with loan forgiveness programs, increased reimbursements, and increased family physician salaries. The House Republicans say the government does not create jobs, but the ACA creates the need for tens of thousands of private sector health care related jobs. Does access to health care save lives? This is the most troubling statement in the House Republicans' newsletter. From early detection to treating chronic diseases, going for regular checkups, receiving necessary prescriptions, and if there's a problem, being treated by the best medical providers at the best equipped medical facilities in the world certainly saves lives. Nothing more needs to be said. Ladies and gentlemen, the last point you could read for yourself, but I want to be able to really have honest discussions and not afraid to maybe offend or challenge the conventional wisdom that some of you might be thinking. We would like to have this, and there will be discussions in subcommittees and full committees over the next several months. I only ask you to bring some of the things you are thinking about, or bring to us what you are hearing, so we could have the opportunity to provide you with accurate information. I can say there's probably more written on the Affordable Care Act and how it affects Iowa than any other federal program we have ever attempted to comply with. So it's not unusual that we will start from maybe more of our personal bias rather than accurate data that's being provided for us. Mr. President, thank you for the time, and I look forward to discussing this with any of you at any time in the future. Thank you.